Okay. Okay, people are joining. Hey, everybody. Just so you know, we got the chat working. If you want to ask any questions, you can just park them right into the chat, type away. If you want to find the chat, if you go towards the top of this screen, at top of the screen, there's a little button that says chat. And this meeting is being recorded and it will be on YouTube as soon as I get a copy and I can edit it, and it'll be up in the next couple of days. And if you have any questions, we'll save them till after the discussion between Daniel David and Dr. Tyndall. And you can type them into the chat or the Q&A if you figure out where that is. Hi, Marianne. I see your hand waving.
I am in the middle of this thing. They can hear you screaming. Stop.
Ashley, can you mute? Thank you. Oh no, you're Dr. Tyndall. We muted you. You have to unmute yourself. Okay, I think you're unmuted now.
Okay, am I unmuted?
Yeah. We're just waiting for people to roll in, and then I'll do the introduction to part 2. And then we'll do that.
Great.
Okay. Well, okay, everybody. I want to welcome everybody to part 2 of Smoking, Vaping, and Health Equity. We have our special guest speaker here today, Dr. Mark Tyndall. I know on the agenda, it did on the invitation that we sent out that Sam Tam, president of the Canadian Vaping Association, was going to be the moderator. However, we have made a few changes. The moderator for tonight will be Daniel David, and he is also with the Canadian Vaping Association. The theme tonight is Smoking, Vaping, and Health Equity. Also, I just want everybody to know that the November 20th, the part 3 of this webinar series is going to be pushed. I do think most likely November 27th, only because a few of us will be away that week, and it'll be very difficult to actually coordinate the time differences at that point. So without further ado, we're just going to wait for Dr. Tyndall to get back to his seat. I'm going to hand this all over to Mark, and after he is done, him and Daniel David will have a conversation. Again, put your questions in either the Q&A or chat. Hopefully you find where the chat is. You just kind of go above where the photo of Dr. Tyndall is. Above there, you'll see chat, Q&A, and then on the right-hand side, it should pop up. Okay? Over to you, Dr. Tyndall.
Great. Okay. Thank you very much, Maria. Maria and Ashley and I were just messing around with the technical things here, so I'm just sorry I'm a little bit disorganized, but I think it's basically working. So first of all, welcome everybody, and I'd like to thank Maria and the Canadian Vaping Association and Daniel David for helping organize this. It really came about because of the book that I published on vaping, and I wanted an opportunity to discuss some of the book and that's why we came up with this webinar series. So the first webinar, which Maria said is currently up on YouTube. So if you missed it, you can watch it. Give some background about why I ended up being an advocate for vaping, and how my experience with harm reduction and working with people using other drugs really led me to this place, and how I ended up even writing a book about it. And today I want to talk about one of the main areas that I think need to be pushed hard, and really for our policymakers and public health people to realize that certainly in Canada, smoking cigarettes is not an equal opportunity type of activity. And we've seen major changes over the past few decades in the number of people who smoke, and actually who is smoking. And really, to me, this is a health equity issue, and that we need to have that really front and center as we make our policy decisions. And I always say, if the richest 15% of Canadians were smokers, we wouldn't be having this debate, and there'd be widespread uptake and acceptance of safer nicotine products. And so it's really, we need to emphasize the fact that this is not equal across all Canadians, and certainly that this concept goes for globally too. So poorer countries have higher smoking rates, and we need to take that into consideration as well. So I have a few slides to share. Just to make sure this is working. Okay. So can somebody just confirm that they can see my slides?
Yes, I can.
Okay. So this is as I say, we're going to talk about smoking, vaping, and health equity. Just to, for those who don't know me, I have a background in public health. I'm an infectious disease specialist, and have more recently become more of a community activist. I was a professor at the University of British Columbia, and previously was the head of the BC Centre for Disease Control. And I left that position about 2 years ago, or almost 3 years ago now. And I, though I have some affiliation with UBC, I'm no longer on the faculty there. So what I'd like to cover as an overview is really who is smoking cigarettes. Look at stigma, apathy, and structural violence, and that's a term that I'll define and explain. I don't know if you hear that. Somebody seems to be lighting off firecrackers outside my house. Talk a bit about youth vaping, and then the predictable consequences of prohibition. So I think it's important, and many people know this already, but this is from the Canadian Tobacco and Nicotine Survey done in 2022. And overall, it's estimated that about 10.9% of adults in Canada smoke cigarettes, or 3.5 million people. Youth smoking is actually at historical lows. So while a lot of the focus around vaping and tobacco is about youth, this survey found that 4.2% of youth had used a tobacco product in the last 30 days, but only 1% of youth 15 to 19 years of age were smoking. So that's at a very historically low levels, and even as 10 years ago it was closer to 5%. Among First Nations, it's about 30 to 80%. I mean, obviously it's hard to generalize across the whole population, but there's very rates, about 3 times the rate of smoking among First Nations people in Canada. And there's really major outliers, such as in Iqaluit, in Nunavut, where it's up to 80% of people in that city smoke cigarettes. So it's just pretty much everybody, and youth smoking rates there are extremely high also. So there's a real disproportionate number of people in First Nations who smoke cigarettes. Among the LGBTQ community, again, probably twice to 3 times the prevalence of smoking. Among gay men, it's about 25%. People who identify as transgendered, it's 35% plus. So again, a community with very high rates of smoking. People with mental health, over mental health diagnosis or mental health illness, again, much higher than the general population. Schizophrenic people, for instance, or people with a diagnosis of schizophrenia, estimated cigarette use in that population is about 70%. And if you look at the graphs over time of smoking prevalence in Canada, it's gone down substantially in the past decades, and probably about a drop of about 1% per year. But among people with schizophrenia, it's been steady for 20 or 30 years. So it's very high rates in that particular population. And then what I've been involved in, 30 years, the last 25 years or so of my career is working with people who use other drugs like cocaine and heroin and crystal meth, and smoking rates there are massive. And so I just wrote down 80%, but in a lot of the cohort studies that I've been involved with, it's essentially everybody in the cohort. And I was in charge of a study called VIDUS, which was the Vancouver injection drug use study. And about 1,500 people were being followed in that study over time. And the prevalence of smoking was over 80%, and some years as high as 95%. So we ended up when we were doing our studies, we didn't even ask people about smoking cigarettes because we just assumed everybody was. So these are just some examples in Canada of populations with very high rates of smoking. And it also is, it's true that these populations are very isolated from tobacco control measures, and are very unlikely to be offered nicotine patches or other standard smoking cessation tools. Many of them are not buying commercial cigarettes, so the very high taxation is not impacting them. People who live in the downtown east side of Vancouver buy their cigarettes for $3 a pack, or buy big bags of loose tobacco for just a few dollars. So nobody's going into a convenience store and spending $18 or $20 on a pack of commercial cigarettes. So it's these people are also not only do they have high smoking rates, but they're much less likely to be offered any smoking cessation tools, and they're not impacted by what we're trying to do to reduce smoking in Canada. This is also to do with populations in Canada, and this is looking at the harms associated with combustible tobacco versus other safer nicotine products. And I think this graph, many people are quite familiar with it, but I think it's really important to note how much safer these other nicotine products are. So the e-cigarettes and oral products, which include oral pouches, are negligible as far as their risk goes, and when they're compared to cigarettes on the yellow graph there. So when people talk about risk, it's not really a continuation of risk. It's like super high risk for combustible products and super low risk for non-combustible products. And Canadians are not aware of this for the most part. So this was again from the CTNS study from 2022. And among Canadians who reported smoking in the past 30 days, the majority either didn't know how harmful using a vaping device with nicotine was in comparison with cigarettes. So over 30% didn't know, or another 30% thought it was about the same as cigarettes. So there's huge amount of misinformation out there. And as people involved in the vaping industry will tell you, there's a government-sanctioned muting of any information about relative risk. And so if you go into a vape shop, you're likely not to be able to find out real information. If you follow the government rules, people in those shops are not allowed to say that vaping is far safer than cigarettes. And this is obvious to what's been found when we do surveys in the population, and people are just totally misinformed about this. And in my experience also, even people who currently have, switched from cigarettes to vaping, are still in the back of their mind. They're unsure if they're doing the right thing. And we really need to get the information out there and be upfront with people that this is a really important thing to do for their health. And it's just far, far safer. I just want to talk a little bit about how we, treat people who smoke cigarettes in Canada. And this has been my world, for 25 years, dealing with people who are using these other drugs. And the health consequences of people who are using drugs, it has very little to do with the drugs themselves, but it's really the situation in the environment that we put people in. So it's very hard to, hold down a job. People are paying exorbitant amounts of money for the drugs that they're using, and they're basically discarded and isolated from society. So these are common pictures around Vancouver, where people are really forced to be homeless and have no money and live in constant poverty, and the violence. And because of this is not just because of drugs, or this just didn't happen by chance. And we set up structures with prohibition and punishing people that push them into these situations. And also we have very little ways for people to get out of this situation. So there's just back and forth to jail, and back and forth from a house to no house. And we've really put people in a very difficult situation. And we call this structural violence. The actual definition of structural violence, this is one definition by somebody named Paul Farmer, who I knew when I was in Harvard, and also in Africa. Paul has since passed away. But the definition of structural violence is one way of describing social arrangements that put individuals and populations in harm's way. The arrangements are structural because they're embedded in the political and economic organization of our social world. They're violent because they cause injury to people. And so in the world of drugs and substances, we've created situations for people with our social situation that's really it causes a lot of harm and injury to people. And it's easy to think of heroin users or cocaine users in this situation, but there's structural violence associated with cigarette smoking too. And these would be common pictures that we don't necessarily think of structural violence, but it is really putting people in harm's way, and really isolating people and stigmatizing people. And it's quite common that because of no smoking in buildings, that people have their smoke breaks and standing outside. In hospitals, there's patients all around the hospital trying to grab a cigarette. And even in airports, we decide that the only way we can allow people to smoke is to put them in a cage somehow, and just wallow in tobacco smoke. So these are all societal inventions that really stigmatize people and force them to be sort of outside the normal structures of our society, and kind of blacklist them. And that's what we've really done to people who use cigarettes in Canada. We've put these signs everywhere, so there's people are confronted all the time with no smoking and now no vaping signs. Another example of how public health and the government has not recognized the difference in the safety between smoking and vaping is that they just lazily added vaping to all their non-smoking signs. So it's when they have really nothing in common as far as risk to health or even risk to bystanders. So one of the arguments to get people off combustible cigarettes is we want to also reduce secondhand smoke and secondhand exposure, and that's hardly ever even talked about. But the benefits to society for people using vaping or e-cigarettes is really high, and we should be promoting that as another reason to get people off cigarettes. And then as far as structural violence go, we think nothing of putting these kind of graphic, grotesque pictures on cigarette packages. And again, highly stigmatizing to people, and really cruel and unusual punishment. So, the one in the corner there about tobacco in infants, what if one of your children did die of sudden infant death syndrome, and you had to look at that package, or you were a smoker, and the generational picture of a mother and a daughter both addicted to tobacco. I mean, we wouldn't do this with any other substance or any other public health campaign. We wouldn't put pictures of fat children eating ice cream on a billboard and mock them for obesity, or as a way to scare kids out of their ice cream, or diabetics with no, a picture of a diabetic person who's lost a leg and put, this is what diabetes does to you. I mean, we just wouldn't think about doing that because it's victimizing and cruel, and in some ways mocking people. And but with cigarettes, again, because of the structural violence that we've surrounded with smoking, we think nothing of putting these kind of advertisements out there. The latest bright idea from Canada is to put labels right on cigarettes themselves. I mean, I can't imagine that this does anything but make people feel bad about their smoking, but it does not stop people from using cigarettes. The one thing it shows me is that in walking around the streets, especially in poorer areas, there's none of these the cigarette butts that are thrown on the ground have these labels, which means that the cigarettes people are using are not commercial cigarettes. But again, this is to me just shaming type of programs and campaigns that do nothing to stop people from smoking cigarettes, but just further stigmatize and shame people. In my whole work with people who use other drugs, there's campaigns that say support, don't punish, but the way to help people get off drugs or get off cigarettes or whatever our challenge is, it's really empathy, support, and connection, not shame, punishment, and isolation. And with cigarettes, we've decided that the shame, punishment, and isolation is the best route, and clearly that is not. That's not very effective for people. Okay, I just want to talk a little bit about youth vaping, and again, that is really at the core of the opposition to e-cigarettes. So this is, we have, as I showed at the beginning, 3.5 million people who are already smoking, and somehow we're only worried about new entrants into smoking. And as a public health person, I think a lot of our work is what's called primary prevention. And something like cigarettes, we recognize that once people start, it's hard for them to stop. So it makes some sense that we want to prevent people from starting in the first place. And we've done a pretty good job, or that's just naturally happened. And again, I show that 1% of Canadian teenagers, outside of the high risk groups at least, are currently smoking cigarettes on a daily basis. So it's all but gone. But vaping has came up, and it's it filled the headlines, and I describe it in my book as a moral panic that all of a sudden teen vaping became the most feared risk factor in youth growing up, and clearly that's not the case. There certainly was a lot of push by some companies, and certainly social media got a hold of vaping, and it sort of peaked in about 2018, 2019. This is a graph from the US, but it's pretty similar to the Canada. I just couldn't find a graph as neat as this one, but really the peak in North America was really in 2019, and every year since then it's decreased. So the number now of teens that report vaping in the last 30 days in Canada is probably about 10 to 15%, not the 30%. And that does not mean that those kids are addicted to nicotine. It's just that kids try stuff, and there's more kids who are trying cannabis and alcohol than there are vaping, but vaping has really stood out as something that to be feared, and that's really driving a lot of the policies around, or at least that's the political justification for making vaping products difficult to access, and things like flavor bans are really aimed at young people, and it's really just not that big a deal or a big an event. I do think that young people and cigarettes are important, but maybe for reasons that aren't talked about. Obviously, one of the biggest reasons for young people to smoke is because their parents smoke. Or their close relatives smoke. So obviously, if we could get them to transition to other nicotine products and away from cigarettes, it would have a huge impact on kids and reduce smoking rates even lower levels. There is some concern with secondhand smoke. So you probably don't want to grow up in a household full of smoke. And so again, if we could get parents to switch, that would have major implications for young people. And finally, just not losing parents as early. So if your parents smoke, there's a more than a 50% chance they're going to die of a smoking related disease, and that smoking related disease would probably occur 10 to 15 years earlier than they normally would succumb to an illness. So again, just not helping kids, not lose their parents early, I think is also a prime reason to try to push safer nicotine products. But somehow we've got it upside down that this is a reason because we don't want teenagers getting exposure to nicotine, and that should be quite secondary. We've used the same sort of, over the top campaigns to try to prevent youth from vaping. I think they don't really do anything except make vaping seem more appealing. But campaigns, it's the next generation cigarettes for the next generation of addicts, calling kids who, vape addicts is again quite derogatory and stigmatizing. And the campaigns out there with pictures of kids with like scabs on their face and things that have nothing to do with at all with vaping is really kind of over the top, and again very stigmatizing, and I think unhelpful in most youth campaigns. I just want to talk a little bit about prohibition and social equity. So this again affects poorer people. So there's a huge push for to stop contraband sales. Most people involved in contraband sales are or the people on the street selling these contraband cigarettes, or again, usually from lower socioeconomic status. And there's a real clampdown on that people. And then we spend so much money on prohibition. And the biggest example, most recent examples in Australia, where it's turned into a massive crime wave because they have some of the strictest vaping policies in the world. And there's just so much happening beneath the surface, and they're basically turned the whole nicotine industry over to the illegal market, where governments can't tax and we can't regulate them. So it's really a terrible way to push the whole industry underground. And we need to support, quality controlled. It's in everybody's best interest, the retailers and the consumers, to get quality products. There's, when I show the graph of safer products, those are commercial products, and there's still the risk of getting contamination and things that we don't want in these in vaping products and pouches and other things if they're produced by the illegal market and with no quality control. And obviously we've seen that in what's happened with fentanyl and heroin and cocaine and all these other drugs that are not sold at all through commercial markets, but are totally controlled by criminal gangs. And you can get some, very, very harmful substances that are being sold. So the prohibition just drives the whole market underground and is a very bad turn of events. My understanding is, up to 60% of all cigarettes sold currently in Canada are from are contraband, and that serves nobody any good. Okay, so this is just a kind of summary slide then. So what policymakers need to know. So I think we need to make it very clear that restricting access to vaping is hurting the most vulnerable in our society. So the graph that the tables that I showed and the numbers that I showed, that cigarettes are not equally distributed across all of our society, and there's certain very highly vulnerable groups that are taking the brunt of this. Structural violence is built into our drug policies, including tobacco, which makes it very difficult to get the correct word out there and to change that. But we need to acknowledge at least that we've set up structures in our society that heavily penalize people for using any substances, including tobacco. Vaping is a youth issue for different reasons. So the reasons that I outlined, prohibition always makes things worse. And then smoking is primarily a health equity issue. And as we, fight for access and better products for smokeless nicotine, I think we need to remember that it's really a health equity issue. So I think I'll stop there. We can cover more stuff with Daniel and have a discussion, and then we can get the chat active also. So thank you.
Awesome. Thanks, Mark. If it's okay, one thing I kind of want to start off with you on, just in the latter part of your presentation there, is that impact of prohibition, or those types of government policies that are excessive on vaping products and what they do to illicit market. It's something that the industry struggles with constantly, and we've actually over time monitored and watched what the impact is. what happens? Quebec is a really good example. BC is another example. Unfortunately, there's some policies in BC, particularly like their 2 ml policy, not to mention Bill 24, but those kinds of things. What they do is they encourage illicit market activity, and those products aren't controlled. So, if a company is going to sell products in that market space and already violates a bunch of laws, chances are they're not reporting all of their ingredients. They're not doing things the right way, and then there's a lot of risk there. Unfortunately, we see this all too often. It's a major thing from the advocacy standpoint, or the industry advocacy standpoint, that we bring up very regularly as a major issue. Because I mean, the demand for vaping products exists. It's there. It's not going to go away. It's only going to grow. So if you try to prohibit something, well, we've already gone through that. You talk about that you've got a great chapter on that in your book. It's not going to go away. But we've already learned this lesson. And unfortunately, a lot of the times we don't apply it. There's provinces across Canada, like I mentioned, BC, Quebec, Nova Scotia is another one, New Brunswick, that have really taken very excessive approaches to vaping, treating it exactly like tobacco, and we are starting to see the consequences of what that does, and it's not good because the products they're not controlled, they're not regulated, just like you said. So I did want to just start with that because it is a very important point, and I think you highlight it quite well.
Before you answer, Mark, do you mind removing your share screen?
Oh, sorry.
So,
Yeah.
so everybody can see you guys clearly?
Oh, I didn't realize. Okay. Is that better?
Perfect. Yeah, perfect.
Okay.
Thank you.
Great. Good. Thanks for reminding me. Yeah, I think this is, my whole career has been around illegal drugs, and fentanyl is like, a great example that's killed hundreds of thousands of people. It's and it's all because of prohibition. And people have, fentanyl is a very horrible story where fentanyl as a drug itself is can replace heroin, and people can use fentanyl regularly and safely, but it's so potent that it requires some skill in mixing it up, and since it's so easy to make, many people have got involved in it. So when I arrived in Vancouver, this was known as a heroin place, and people came from all over North America to get heroin from Canada, from Vancouver, because it was white Afghanistan heroin, and it was only available through certain channels. It took a lot of organization to get a poppy from Afghanistan to the streets of Vancouver, and it was highly controlled. And then when that stopped and fentanyl took over, all of a sudden you had a product that anybody could make up in their basement, basically. And that started happening. So it's very difficult now because there's not one group that's importing heroin, but there's lots of groups, hundreds of groups all over the place making up fentanyl, and they don't know what the hell they're doing. So we have situations where, there'll be a week when there's no overdoses from fentanyl. Everybody's using fentanyl, but somebody's mixed it properly. And then you have a week where there's, everybody on the streets falling down, because some idiots, mixed it up improperly and put it. And so, that's quite a, extreme example of what can go terribly wrong. But the same principle is with vaping products too, because it's easy to mix up flavors and mix up stuff. And we saw it with the Valley, when the THC got mixed with vitamin E oil. I mean, I don't think the people doing that were trying to kill people, but they didn't know what the hell they were doing, and they put the wrong stuff in. And so, you know, you don't, you know, these are still products that require some, you know, quality control. And we don't want people harming themselves. So, and it makes it difficult as a, you know, physician, you know, advocating for vaping products when I don't know where they're coming from. So, I mean, you know, people make up stories. There's all these contaminants in the liquids and all these contaminants in the products, and their coils are overheating and metals and stuff. And it's true. I mean, it's not entirely made up. That has happened. It doesn't happen that often, probably, but there, you know, it makes no sense as far as public safety goes to let the illegal market control this. And that's what we're, you know, the more prohibition we put in place, the more that happens. And I think with nicotine and tobacco, as opposed to, you know, heroin and crystal meth, harder drugs, people aren't as afraid of doing this, right? It doesn't, you know, it's no big deal, you know? So I think anybody can get involved, basically. So it opens up, you know, many more opportunities. And the other thing is, I understand that, you know, very well organized groups that deal in other drugs are taking on the nicotine portfolio too, because the number of people using these substances is so massive that it's a real huge profit maker. And
well, yeah, and that's exactly the problem is, I mean, for vaping products, it's so easy to get into. Criminals, and where does that funding go? Organized crime.
Yeah.
So wherever that funding goes, you're doing it illegally. But I mean, a big part of that issue also stems to enforcement. You know, if you're creating policies that are strict, you have to ensure that you have the capability to enforce them. Unfortunately, we struggle with that all the time, where enforcement resources just quite aren't there. They take years and years and years to catch up with the policy that's set. And that creates, you know, some degree of danger. Even, you know, granted, just like you said, I mean, for vaping, it's certainly not the degree that you would see with like fentanyl and other tainted drugs or anything like that. But I mean, nobody wants to trust that kind of group with, you know, a product that is highly profitable, that they can sell illegally without taxation, without reporting ingredients, without doing, you know, everything that the legal industry does.
Yep. And
nobody
it's
wants
also
to trust
people,
that. Like,
people are much more, you know, we've turned, you know, half of the cigarette smokers in Canada into criminals, basically, because they're buying contraband cigarettes, you know, because they don't feel like, it's not like they're buying heroin, they're just buying cigarettes. So it's, you know, and we've, you know, taxation is prohibition too, if it gets to a ridiculous amount. So I understand that the average person who's needs a pack of cigarettes a day doesn't really want to spend $20, and when they can get them for $4 or $5. So they don't even really feel like they're criminals, you know, or the people selling them feel like they're doing a public service, basically. So it's not a, you know, it's sort of not like the heroin salesman, you know, it's just people trying to help each other out. And it's leading to, you know, all this unregulated products out there, and we've given the whole thing over to the illegal market. So it's crazy that we want to do that with vaping products and nicotine products too. And you know, I've been to so many meetings that with all these policymakers and legislation and all that, and in some ways they're just talking to themselves, because what they're doing doesn't really make any difference. Like you can make all the policy decisions you want, but if 80% of the people are not even buying them from your regulated stuff, then it's basically doing is penalizing people who are trying to sell real products and not making any difference at all to what's actually happening on the street. So they're just talking to themselves and wasting their time, basically.
Yep. No, and that's a major problem that we continue to deal with. Like it's a major challenge, but it also actually ties into a little bit what you were talking about with the skewed perception of risk. Because clearly, obviously, I mean, we don't want an illicit market. There are dangers there. You know, when you're vaping, you are inhaling something, right? A legal product reports all of its ingredients to Health Canada, has appropriate warnings and all that kind of stuff. But, part of that skewed perception of risk, and you had mentioned a little bit about it, the lack of ability for those legal businesses to be able to not even promote, but talk about the comparative harms. Like, so, comparing tobacco smoking to vaping. Vaping is much less harmful than smoking tobacco. Relative risk statements like that. There was a time where Health Canada did release some proposed relative risk statements that businesses could use. However, that never actually was finalized. So there's so many limitations. And one of the problems, and just like a quick personal story. So my teenage daughter, she's a couple of friends, she's sitting at Tim Hortons, and her friends, the three other friends she's with, see somebody outside smoking, and they're like, "Oh my God, that's so disgusting! That person is doing so much more harm than they should just smoke then." That perception of risk in Canada has been so skewed because of media, because of misinformation, and you mentioned a valley. I mean, popcorn one comes up. These types of things really, they're not controlled. And so when the headlines constantly say that type of stuff, or media reports constantly say it, we're starting to convince a whole group of people that is the case, that vaping is just as, if not worse than smoking. And that's a terrible, terrible place to be.
Yeah.
And it's a really difficult place, for a legal industry to operate in as well. So it's a major problem. I think at least some of the presentations I've seen, even from Health Canada, just kind of accepting that reality that, we do need to do better as a country to correct that perception.
Yeah, no,
of risk.
I visited many vape shops, talked to people, what they can say. I mean, basically you're telling people to lie. Like you could, if you were selling bicycle helmets and you couldn't tell them that it's really not going to make any difference whether your kid wears a helmet or not. Like, no, or, I can give you a condom, but it probably isn't any different than not using a condom, So it's ridiculous, how that's muzzling has happened and why. And that's all my conversations with anybody from Health Canada or politician like this. You have to stop this. This is outrageous. I mean, you can't say it. And I'm really careful to talk about no harm and risk-free and things. But if you really think about cigarettes, which we think are, we advertise them as deadly, but we know that nothing really happens like health-wise or endpoint-wise. I mean, so I'll retract. I think people who smoke cigarettes have a gradual decline in their health, and mostly respiratory status and things. But the actual things that we measure, like COPD and heart attacks and lung cancer, and take a long time to develop, decades. And even though the toxins in cigarettes are so horrible, it's not instantaneous. Your lungs are incredibly resilient. And so and there's all kinds of stories of people who smoke for 50 years and they don't have lung cancer yet, So, but my point being that although cigarettes contain so many carcinogens and toxins and they're so harmful, it still takes a long time. So if you then say, well, there's only, 5% of the formaldehyde or 5% of this toxin, or you know, or negligible amounts, it's going to take like 300 years before that would affect your lungs in a bad way. You know, so I mean, it's very safe, you know, to nicotine, and especially in the short term. So you know, we also have amazing data that people who stop smoking after 15 years have a pretty much a normal life expectancy. I mean, it's never too late to stop, and it has just so many benefits. So to tell you know, retailers that you're not allowed to tell people any of that information, I don't know how they can justify that, or where that comes from, you know?
Yeah, but then and then at the same time, you know, we talk about youth use and youth advertising and all that marketing, that kind of stuff, products targeted towards youth.
Mhm.
But it's not the industry that ever targets youth.
No.
If anything, and you showed some pictures there, if anything, one of the concerns is that the only people that are showing like kids vaping is media and some of these other groups that are anti-nicotine or anti-tobacco groups.
Yeah.
And you had some of those pictures up there. And one of the things that, you know, because we were just talking about, you know, harm and relative harm and that kind of thing, you know, they always miss is that, you know, in these articles that the dose makes the poison. So you know, sure, you could say that there's formaldehyde in a vape. What level? I mean, we exhale formaldehyde normally, but so it's the level that matters. But you know, there's a sensationalization of, you know, anything that can be found, and it adds to that skewed perception of risk that we were talking about,
Mhm.
where it's like, oh my God, like, you know, the media just said that, you know, there's formaldehyde. Well, I know formaldehyde is bad, so
Yeah.
holy cow, you know, this must be even worse than smoking, without
Yeah.
realizing that when you smoke a cigarette, that there's you know, 10 or 100 times more of that compound
Yeah.
in there.
Yeah. No, it's not. You know, these exposures they can't be considered all or nothing. You know, it's very dose dependent, and we're breathing. You know, I say, you know, it's better to breathe fresh mountain air and walk through the forest every day, but that's hardly what we're doing. Most people are doing. So you know, it's yeah, it really is so much safer, and to have governments basically muzzle people from that, telling that information is crazy, and really ridiculous. The
Well,
other, yeah, the other, you know, the other thing I didn't touch upon as far as retailers go, I find it interesting too, as far as the prohibition goes. It's really led to a way that these products are often sold or tried to sell, that's really become, I think, you know, cheapened in many ways. So in British Columbia, the shops that I visit sell vapes in the back of the store. The rest of the store is junk, like candy and kid stuff. Like, it's a 19 plus store, but people still buy, you know, potato chips and gums and all kinds of pops and drinks. And then at the back, there's a little blocked off area where they can sell vape products. And so it's really become like, I'm all for making it accessible, but because of the prohibition and the laws, it's really taken away from, you know, a real vape shop and having an opportunity for somebody to go in and know they're getting quality products, talk to somebody who's knowledgeable, and, you know, get their safer nicotine. And it's because of these restrictions and prohibition, and stores have tried to get around all this, that they've made up all kinds of new ways to sell it. And you know, the other crazy thing with the, you know, the shaded windows and stuff, that, you know, it makes people think they're going into a porn shop or something, and it's just not a very welcoming place for most people who wouldn't even open that door, you know. And so these kind of restrictions on how we're selling it have really pushed the the sales to the back of the thing. I mean, compared to a cannabis store or something where you go in, there's quality products there, and pretty much there's always a knowledgeable person who can help you. And at least in BC, that's not happening. You're either going into a shop that's blacked out and nobody wants to go in there, or you're dealing with a really cheap and down kind of convenience store type place. And I think that isn't attractive to a lot of smokers. And we're really, we focus so much on youth and younger people, but the people that we can really make a difference to are your 40 and 50-year-old who has smoked for 20 years and really needs to stop. And we're really, because of all the prohibition and the misinformation out there, the way the products are now being sold, we've really missed that. And we're really not, we're not focusing on the people with the most need.
Yeah. And I think that, some of that, like I mentioned before, I think, Health Canada has to a degree recognized that is a problem. That perception of risk. We still have, 3.8 million smokers in Canada, 3.5 to 3.8. And most of those people do believe that, okay, well, vaping is just as bad, if not worse, than smoking. So it's almost like the better the devil type of mentality. And that's, when there's an opportunity to reduce your harm, that's actually a really important thing, because for most smokers, and I was a smoker and switched to vaping, a lot of the other products don't work. If you try all the other NRT, the patch, the gum, those kinds of things, you talk about that in your book, why they're not effective. But if that doesn't work and you go through that process, well, then there's another option, and it's unfortunate, but it's also an opportunity, I think, too. If we can really push to correct that perception. And I will say that there is some, movement, at least from some of the agencies at the federal level. Health Canada, I mean, they do have some corrected some misinformation on their website. They do have some decent information, certainly a lot better on the education side than you see from a lot of the anti-nicotine groups that come out. So I it is starting to move a bit more in the direction that we want. I mean, there's a lot more to be done, clearly, because we continue to see new regulations, new legislation that comes out and that punishes vaping and reinforces the stigma that is the stigmas and the skewed perception of risk that's already out there. So I mean that's a real challenge.
Yeah, when you think about a politician making their statements, it's a win-win to be against vaping, right? You're protecting kids, you're against addiction, you're if you're adding taxes, you're collecting more money. I mean, it's pretty attractive for a politician to get up there and start railing against vaping. I mean, it's a no-brainer, almost, for them. As far as the who's giving the messaging and stuff, and that you would think that the doctors would, especially people who understand a bit about harm reduction, but my experience is that in my colleagues, they haven't bothered. Like they're just they're misinformed too. They're just lazy about it. They haven't really looked into it. And my close colleagues that now have to know that I wrote a book about it, I've dug a little bit deep, but majority of general practitioners don't recognize it as a safer way to go, and are just totally inundated with what about the youth, and what about these evil big tobacco companies, and they've been just fed this stuff, and they've just basically accepted it. And I use the example, if you had somebody come in as a physician, if I had somebody come in with hypertension, and I would tell them that your blood pressure is really high, and we know that over time this is going to cause you problems, with heart attacks and strokes and vascular problems. And I didn't offer them anything. I just told them they better get their blood pressure down. And then they come back the next year, and I take their blood pressure and it's super high. And I say, look, you really need to get this down, And then they leave the office, and they come back next year, and then the next year. Now, like after 20 years, they come back, and then their family calls me and said, oh, my father had a stroke. He's in the hospital. And I go, yeah, I knew he'd have a stroke. He had such high blood pressure for 25 years, and I kept telling him to get his blood pressure down, and he didn't. I'd be charged. It'd be malpractice. Well, like, why didn't you offer my father antihypertensive medications? And I'd lose my license. But somebody was smoking. They can come into my office, and I say, look, I know the smoking's really going to get you, and you better stop. And they don't, and then they better stop. This happens 25 years, and then their family calls me and says, my dad just had a stroke. And I said, yeah, I knew he'd have a stroke because he smoked so much. And did you ever offer him anything? Oh, no, I didn't. I didn't believe that vaping was any safer. Well, it is. It's malpractice. It's we have a tool now that's a treatment for smoking. And this treatment should be high on our list of anybody who smokes. It should be the same as with hypertension or diabetes or all these other things that we're so concerned about, and we give people medicine for, and we give them treatment for. And basically, I see vaping and pouches as a treatment. And if I'm denying that treatment to people, I think it's an ethical dilemma. I think it's malpractice myself. And obviously, that's not the way vaping is looked at right now. But as far as a medical intervention for something is as serious as smoking cigarettes, I think that we should really look at it as a treatment for, or even a cure for smoking. Like, I just cured your smoking. So that's the way I kind of make my argument. But again, I don't have a lot of people who thinking that way right now.
Yeah, and certainly less harmful, very much less harmful alternative. You can always recommend, the NRT approaches, but just like for me, when that doesn't work, vaping did. So,
well,
and vaping is significantly less harmful.
What I've learned in harm reduction, you should try to find something that's as close to what people are doing at the time. So I think that the approach to smoking cessation should start with vaping or heat not burn products, or something that's most like what people are doing now, and then wean them down. But to start off with something doesn't work, again, as a doctor. So somebody comes in and I give them a nicotine patch, and a year after year they use a patch, come back, did the patch work? No, I'm still smoking. It didn't work. And then, as a doctor, you just kind of laugh and go, oh, I knew it wouldn't work. Like, why did I get, it only works 5% of the time, why, I knew it wouldn't work. And so you want to start with something that's likely to work. And then if people want to reduce their vaping or don't want to, then you can start with other forms of nicotine. But I think the step-by-step shouldn't start with, when all else fails, why don't you do that? And that's a way we've approached it with drug use for the most part. I want you to stop abstinence, and then if all else fails, maybe I'll give you methadone, or maybe I'll try, but no, you should start with the thing that, and so for me, the starting point with somebody who's got an opioid addiction is to give them some opioids and give them a hydromorphone or something that's much like what they're taking now. And then we start working them down. But to start off with abstinence, no. If you have diabetes, your doctor doesn't say, well, stop all sugar like that, just stop everything. No, you start by slowly introducing people to modifying this, modifying that, even with their smoking approach, people can try patches, but the first thing you do is, well, why don't you try and cut down on your smoking a bit? And let's try, to wean you down. You're still going to smoke, but And that's, brings me in even into dual use. I mean, this is another crazy piece of misinformation that the government keeps floating, that, it only works, it's only safer if it's 100%, you've 100% transition. Well, no, it's not. If you used to smoke 20 cigarettes and now you only smoke 5 and you vape, I mean, that's great. Like it's helping you. Ideally, that goal should be to wean you right off. But to me, dual use isn't like isn't a failure. It's like that's the way people usually introduce a new habit or new thing.
And how they
So,
transition. Yeah.
how they transition. How else would you do? I mean, there's people that the first time they ever vape, they've never touched a cigarette again. But that's unusual. Most people need a bit of time to change
Most people
what
are
they're
dual
doing.
users at some point. Yep.
Yeah. And it's, I don't know, if you want a cigarette on a weekend with a glass of wine, I mean, I don't know, you vape all the rest of the time, I think you're fine. So anyways, but these are kind of these misconceptions and misinformation that's heavily perpetuated. And then it also feeds into health equity. So people who are most marginalized and most isolated aren't even really questioning this stuff, right? They're not engaged in a lot of this discussion, and they just have to go along with whatever people decide. So we're again totally disadvantaged, and a lot of people from these more vulnerable groups never been to a vape shop, never heard much about it, So it's
I'm sure, like, because I know we're a little bit over time, and Maria's probably going to want to jump in here and see about the question period. So,
how about you wrap it up with one last question? Because I want to give you an opportunity to finish what you wanted to finish. Because I know you're excited about doing this.
Is there any other questions on that we should have acknowledged?
If there are questions,
I'm going to go through the chat to acknowledge the questions. But if David wants one last question to wrap it up and give you guys till about 8:15, 8:17, like 10 minutes. That work?
Sure. I mean, I don't have a really a whole. It's great having the open discussion with you. I think we're pretty much aligned on everything. I guess if I were to pick something, I mean, how you would go about, changing that dynamic at the the doctor level. I mean, I know personally, like, so my family doctor has your book. I'd like to hand that out where I can, so I get some extra copies, because it is extremely informative. And that's one piece that we've always been missing related to vaping is informed people. A lot of times it's just, you read a headline, it's like, oh my God, this is a crazy thing. But I mean, I know the policy side, and how that's always a challenge, but I mean, addressing it from even the, the medical side, you're a doctor. I mean, I know you had mentioned that you had challenges with some of your colleagues. If there's anything that you see along that line that potentially could be helpful.
Well, I think I'll talk about this in the next webinar a bit, about how we change things. And I don't think that it's going to be changed by changing the mind of public health people or doctors. I think it's going to be a groundswell from the bottom and the consumer demand for this. And I think I can, from my position, I can still be helpful in that. But it's really going to take a groundswell, which is happening, but that needs to be really nurtured and produced. But expecting that, I'll go to the Canadian Public Health Association and give them a talk and tell them the truth, and everybody will say, oh yeah, you're right, is not going to happen. People are quite entrenched in their beliefs, and I think quite lazy and really looking at this as a major opportunity in public health to change the trajectory of cigarettes. And so I think that it's much more likely that we're going to win, but it's going to take a groundswell of consumer demands for this.
Yeah. Consumer voices are extremely powerful, as well with policies. So the impact that the consumers can have, we've seen that in the past. So yeah, that makes sense.
Thank you, guys. That was so much fun to listen to this conversation amongst intellects. I enjoyed it. I think we've retained our audience, so that means our audience enjoyed it. Also, hello, audience. I wouldn't be me if I wouldn't do a book plug. So here we go. I'll put the link in the chat. This is Dr. Tyndall's book. It is fabulous. My favorite part of the book is what I wrote on page, no, I always say that. But you can see my review here. If you do have the book, go on Amazon and give them a review, or give them a review wherever you can. If you go to I'll put up Dr. Tyndall's website as well and stuff like that. But we do have some questions. I'll start with this one because I think this is something that a lot of people don't understand with Bill 24 making its way, and also with the history of very anti-THR in BC. Janine Timmons, in BC, I believe we have a reputation for harm reduction, opioid use, but not THR. It makes no sense to me. Can you help us make sense of that? Does that make sense to you?
No, it makes no sense to me either. So I mean, I think that people realize that the harm reduction you think of like with harder drugs, there is some understanding that we need a little touch of empathy for people who are in that situation, and that there's a general feeling that although there's so much stigma and the overriding that people deserve what they get, I think in the society there still is this feeling, well, we just can't let people die and we need to do something. But cigarettes, I think, are on a level where the general public and the politicians believe people can quit. Like they don't understand, like if somebody has a heroin addiction, there's some understanding that it's very difficult for that person to quit. But tobacco, I think people have this understanding. It's not that, it's just quit. Like why do we need a safer product? Why do we need harm reduction if you can just quit? Like, the world does not need safer nicotine. The world needs people to quit cigarettes. And that's kind of I think the attitude that perpetuates and allows people some disconnect from the principles of harm reduction for harder drugs to nicotine. I think people, I know somebody who quit. Why don't they just quit? So why do we care if it's 95% safer? Like it's just stop. So anyways, I think, that's maybe not a great explanation, but that's my thinking why people can disconnect the principles of harm reduction from what we do support in British Columbia to nicotine and tobacco.
Thank you. And I also think it's just that we vilified people who smoke. If we're going to be honest, public health and Canada has done an incredible job. Those old guys who are now should be retiring, but they're not because vaping showed up. Did a very good job stigmatizing people who smoke. So this was not done because of their efforts. It was actually all shame-based, and it still is shame-based. And I think that has carried over into progressive thoughts, because even you could be the most progressive person, I've realized, the drug world and the drug harm reduction world wants nothing to do with us, except for you. Yeah. And we're thankful for that.
Yeah, no, it is a huge disconnect. And I think I talk about this in my book too, like how I actually fell into this is that it's even among the people that are using these other drugs, they're dying of cigarettes. Like it's a main cause of death. So it's huge, you know, and to have people that are like way out there trying to prevent people from overdosing and using drugs and using other harm reduction and just totally ignore smoking is, you know, we're missing the point. This is what people are dying of basically. And we could be offering them. And my experience with, you know, this population, they're really keen to try something and they kind of understand and they'd like to feel better. And so, but then because of policies and taxes and things, starting vaping takes you know, when you can get cigarettes for, you know, 5 cents each on the street, people don't have the, you know, the money for a starter kit. So you know, I've been advocating we should be giving everybody starter kits. You know, if this was really a cure for cigarettes, then, you know, the government should be investing heavily in, you know, getting everybody started. But we're a long way from that, I'm afraid.
Well, CAMH is giving away free vapes, just so you guys know, through their quit smoking program. So at least we're like a baby step, but they're not very public about it. But I mean, we're getting somewhere with Dr. Selby. There is a lot of talk about Bill 24. I think that is top of mind for many people. Daniel David, you'll need to confirm or correct me. BC is not part of the federal excise tax. They don't match it. They have their own.
Right, that's correct.
tax.
Yeah. So BC uses just the federal only tax, but they do have a provincial sales tax of 20%. I mean, they don't account for that particularly, but yeah, they're just a federal only excise province.
Okay, so I think I'll so good, because then I'm going to phrase this question. The healthcare recovery costs for what they're trying to talk about in Bill 24, BC has already placed a tax on vaping products just for those very reasons.
Essentially, yeah, like a sin
so
tax where they've placed it, but I mean, even for that, they don't even have the ability to track it, like where it goes. It goes into general
Okay.
coffers.
So this is a statement we hear all the time, Dr. Tyndall. So if maybe you can give some insight to this. We've been told all of our smoking lives that smoking is just as difficult to quit as heroin. Why do their actions not match their words?
Yeah, no, I don't, they should. I don't know, but yeah, I mean, yeah, no, it's quite a disconnect. So, you know, it's, people know, you know, that even the people who are like the proponents of smoking cessation, I don't even know why we're paying them, because they're very unsuccessful. There's a clinic at the Vancouver General Hospital, this smoking cessation clinic. There's like a specialist in there, and they see hundreds of thousands of people. And if you ask them, well, how successful have you been? Well, not very successful. You know? So they're, you know, so they know for sure that it's very difficult for people to quit. But they, you know, continue to do their, you know, proven smoking cessation practices, which they've only proven that they don't work. So they're, but yeah, so they just they treat it totally different. That it's still, smoking should be like a willpower thing, and you should be able to quit.
Yes, take a long walk, take a bath, read a book.
Yeah.
So this is very interesting, Jackie, and I think you met Ariel at GFN. Ariel with an S.
Okay.
She wrote a blog about how you must take into account the number of quit attempts. The more something fails a person who smokes, the less likely they'll try to quit again.
Yeah.
Ariel Celia. I think,
Yeah.
yes, you did meet her, Dr. Tyndall, because I saw a picture of you guys together on the things, but you met so many people. You were like the star of that event.
Yeah, no, I know she got the award, didn't she, for the?
I think.
Yeah. No, I met her. Yeah. So the point is that the more you fail, the less likely
you're going to try again.
Yeah. No, I think so. I mean, especially if you've been told that it's your weakness, you're not able to stop smoking, then you get beat down over and over and over again. So I'm sure that you get to a point where I'm not going to even bother trying anymore, And those are the kind of people, and there's a lot of them out there, there's somebody, I don't know the statistics, but if you've been smoking for 20 or 25 years, it'd be pretty unlikely you haven't tried to quit at some point in time. Everybody's tried to quit. It's in their own way and maybe in different ways. But then you get to a point where why bother? But then we can offer them vaping. Like, what a miracle. Like, okay, you don't have to quit anymore. You can still use nicotine. We have something better. And the other, crazy thing about this is it's not this will happen, I think, if we just move over and let people get the right information and make their right decisions and have the right kind of access, without the government having like massive investments. And it's not like a vaccine program or even the work I've did. You don't have to build a supervised injection site, and you don't have to train nurses and healthcare workers. And so this could all happen, just if the government got out of the way, basically, and with an informed population, and make it cigarettes far more difficult than other nicotine products to get. And I think most people would go for it. And the beauty of it, you're the best example of this, but I mean, most people who now have transitioned would never go back. It's way better. It's like a modern way to get your nicotine. You're not. We don't do many things that we used to do in the 1930s. I mean, we have better technology now. So this is the new technology, and this is the way people should get nicotine, because it's safe and it's convenient and it's flavored, and it's there's a million reasons why. So as a consumer product, when I try to get people on methadone from heroin, it's a step down. It's not as good. You do not feel the same way when you use methadone as you did when you used heroin. So it's a transition for people. But vaping, it's a step up. You've been introduced to something far better. So
I don't understand. It's very clear to me when someone has never smoked a cigarette, hasn't vaped, when they say vaping is a gateway to smoking, because the truth of the matter is smoking is a gateway to vaping.
Yeah, exactly. You got something better.
You don't go back, and I just wish these people would talk to us. And speaking of those people, public health, Marianne made a comment here that she reached out to a public health unit about a photo that they put online of a kid vaping on all these clouds, and and she said that you shouldn't have that photo, and in their response was, it's okay, we're sending out a health message.
Yeah.
Marianne, can you please tell us what public health group you sent that to?
That's all over the place, though. They do that all over media, and they show kids vaping.
Yeah.
Great, guys. I mean, you're the ones advertising.
Yes, but I'd like to know which one she called out on their show.
Yeah. But again, it's all part of the stigma campaign, and to make it look terrible. People, we've been trained that smoking, you're blowing out smoke. It's very bad for you. So to make vaping sound like it's as bad as smoking, they exaggerate the vape, so it looks like there's way more smoke. People think of the smoking as the smoke is bad. So if we want to vilify vaping, then make the more cloud, the better, and not knowing that you can be pretty subtle nuanced about this. You can smoke in a plane and nobody's gonna know, or vape in a plane and nobody's gonna know, but
oh yeah, no one knows. I
do it all the time.
Condone. I don't want anyone to hear this, because he's gonna find me arrested.
Yeah.
Marion said that she sent them a message back saying that a kid vomiting from nicotine overdose would be a better health message than what they shared. I love you guys. If you want to say something to someone, and sorry, if you want to learn something, if you want to call someone out, if you want to teach something, you have to say, what would Mary and Bert do? And then you will do it. Because honestly, this woman, this is what I do day in, day out. When I'm asking things, I always think, would Marion do this? Oh, hell yes, she would. So we all need a little Mary and Bert in our advocacy. One of the other themes that was coming across, and we've got about 5 minutes left, was informed choice. Vape shops can't talk about comparing it to cigarettes. There's very little information, and I think they want to just a little bit more into that informed choice. Like how we are, like, there is nothing in this world that is allowing people to make the best decision for themselves when there's so much disinformation and a lack of a legal ability. You know, we're criminally tied if we open up our mouths at a vape shop. I mean, when I walk into a vape shop, I tell everybody all the health, I do relative risks, but I don't own that vape shop, and I don't count. But
Well,
imagine.
I was wondering how, because this is just a practical matter, because I've visited many vape shops, but and talking about getting my book in there or getting like a pamphlet, like with real information that people could hand out. So if somebody asks, is this safer for me? If the person feels they can't really address that, say, here's the information. This is the evidence. Please read it, and or the book, the book, obviously people aren't going to stand there and read a book, but I could summarize things, and you could put what's there to stop posters and postering and information, relative risk information being shown in the store.
Well, yeah,
Is that
right now the challenge is essentially, I mean, as we understand it, it's the store itself can't say that. So if you put something like that on a poster, it might be taken out of context or something. So it's more like so if you wanted to have a book there that describes all that, or a piece of material that was produced by someone else. So like if you, for example, had a pamphlet, something that kind of summarized a few things, or if Health Canada did, that would be, in my understanding anyways, okay. Initially what it was more on is, if you were going to make any kind of claim of less harmful, like that, the person would have to have the study, and they would have to, okay, here is the entire printed out study, that's offered in the store, and then you could pick that up, read the study, and then come to your own conclusion. That was part of the limitation, because beyond that, it can be taken as if you're using, a portion of, let's say, a study to say something that could be taken out of context. And so without those relative for sale, yeah, when you're selling products, yeah. So for this, that's why we actually in Health Canada had this, where they proposed, here's a list of comparative relative risk statements that we would be consider allowing to be used, that are true statements. Unfortunately, even after consultation, that never went anywhere. We still don't really have anything.
That's been 2019, but we also
Yeah.
don't have a flavor ban, and that went through consultation. So we're not going to rock any boats. However, you know what I am going to recommend in these last 30, 60 seconds is that every single person here email your vape shop and tell them, I want you to reach out to Pacific Smoke and get this book in your shop. Every vape shop in Canada should have 2 copies at any given time to be able to sell in their shops. PSI has a bunch of books. They can get them out there. Just say, reach out to PSI. And yeah, let's get these into every single vape shop. And I know there's a few vape shop owners. Talk to your rep. I mean, this isn't a sale. I'm just Sally. That's who I am. I want to be on the Home Shopping Network. Again, talk to them, get if there's a demand, they'll bring them in. So if you're a vape shop owner, have 1 or 2 of these books in there, sell them, replace it. And so Clutch is going to be placing an order. There we go. Just when you do your order, 1 or 2 books, even just 1, and then buy another one, refresh it every order. Have it there. It's a good piece of information. Dr. Tyndall, thank you very much.
Okay, my pleasure. Thank you for organizing it. And then we're going to do one more, and I'm going to talk more about human rights and community activism and things like that.
Yes, and I also want everybody to know that we are actively fighting for Bill 24 between Rights for Vapors and CVA. We're each doing independent things, but just so you know, we're trying to figure it out. Number 2, so keep an eye out for your emails. A lot of sharing, a lot of social sharing. We've got to get this message out there. It's going to be a quick and dirty campaign because the government is being slimy and dirty, slithery and dirty. Number 2, Dr. Tyndall and myself and some incredible other experts from around the world are going to be in Geneva. I think like the 19th to the 20th or 21st. Yeah, 19th or whatever, 17th.
17th, I think.
17th to the 21st. We're going to be in Geneva. You can follow everything through the Taxpayers Association. That's an organization in the States. All of the crazy anti-vaping, anti-tobacco people from around the world are going to be there, and they're going to be creating rules for the rest of the world. Let me tell you, they will be talking about Bill 24 there, because they're going to be giving Taxpayers Alliance, that's it. They're going to be giving a pat on the back for what they're doing in BC. But Dr. Tyndall and myself are going to be there. You can watch it all on YouTube. I'm doing a podcast series for them as well. So I will share all that. But the more we know, the better we are. We can't just let the antis share all this information amongst themselves unless we can collect it as well. Okay. Thanks,
Great.
everybody. And we'll have this up on YouTube.
And go Blue Jays.
Yes, go
Yeah.
Blue Jays.
Go Jays, go.
And if you've read the book, go leave a review on Amazon. Thank you.
That'd be good. Thanks. Okay. Good night, everybody.
Good night.
Good night.
Ashley, you'll send me the video whenever?
Yes, I will. When I have it.
Okay. Thank you, everybody.
Ending now.
Okay.